Welcome, everyone, to another edition of the Equip Show. I am Paul Morris, partner with Equip, and here in our Portland office. Today, it is my great pleasure to have Nicole Mandarano from the Oregon Lions Sight and Hearing Foundation on the show. Nick and I go way back, and Nick is the VP of Development and Marketing. Nick, welcome to the Equip Show. I am so glad that you are here today.
Hi, Paul. Thank you for the invitation to join you today.
Absolutely. So, people may or may not know about Lions clubs or Lionism. They may think hearing aids or vision, which I know that Lions are internationally focused on. But I'm hoping we can kind of get into how you are leading the effort to secure resources to ensure that the Lions Clubs of Oregon are able to fulfill their mission.
I'm happy to chat about that.
Cool. Well, why don't we start with what the mission of the Oregon Lions Sight and Hearing Foundation is and what it's focused on?
Yes. So we are focused on, in partnership with the Lions of Oregon, to help more children and adults see and hear. We restore, we treat, we save sight and hearing in partnership with Lions of Oregon. And that includes all of Oregon statewide and a little piece of Northern California. So that's the multiple district 36, of which our Lions are members. So we are partnered with them from the very beginning, from the inception of where we work at Good Sam campus in Portland, and all of the approximately 140 clubs around the multiple district that we partner with. So that's essentially who we are, and we're very mighty in most communities. we are.
Yeah, and am I wrong to think that the Sight and Hearing Foundation is celebrating a significant anniversary this year?
Yes, so we just did. We started, well, actually, the Lions, we attribute them with starting the foundation in 1959. They started that in Oregon. However, you are right, Paul, in 1925, actually, Helen Keller spoke at a convention, an International Lions Convention. It might have been Chicago. So at that time in 1925, she actually said, "Hey, Lions, I'm paraphrasing, obviously, I want you to be Knights of the Blind. I want you to work for preventable blindness and deafness." And so the Lions accepted that promise, or took that promise, are fulfilling it ever since. And so that's directly from Helen Keller. And you're right, that is our anniversary.
Fantastic.
100 years.
Wow, a century of helping people with just two of the most important senses that we have, vision and hearing. Absolutely. So give us a little bit. So you talked about how you're partnering with Lions clubs in Oregon and Northern California. We'll call it Oregon just for kicks. What does that look like? Right. So what is the kind of day-to-day programming that the Sight and Hearing Foundation is doing in conjunction with the Lions Clubs of Oregon?
Happy to share that. Great question, because let's go right to how this actually works, because it does feel very broad. How do you prevent blindness and deafness? So we have several programs, and I'll touch on them briefly if you'd like, each one very briefly. And all of these programs, the staff is located, the staff that operates them are located in in Portland. Some of the programs, they're all statewide programs, but the reason why this works with Lions is because we don't have staff in every place. We have some seasonal staff. But Lions are the ones that identify the problem. Lions are the ones that are ambassadors, if you will. They recognize the problem, identify problems in their community. If someone has a sight or hearing issue, they're active in their community. They know doctors, they know audiologists. And so that network is really what propels our work. So they're helping us identify the need. And then we have resources, whether it's grant funding, whether it's subsidized fees from doctors or audiologists and staff that provide these services. And that could be mobile. We go mobile, we go where people aren't, meaning where there's gaps in service, where people are geographically unable to get to a bigger city for services. So we're not only going mobile, but we're also housed in all the, you know, cities or smaller cities. So you can go to see a doctor in Bend, you can go to see a doctor in K Falls, etc. So see us all as, like, I would say, partners, Lions, or volunteers. Their mission is their life. And so essentially we just have a lot of ambassadors in all these communities. And if you want, Paul, I could just briefly name the programs, or would you like to?
No, let's hear. I mean, I think that what's so interesting, especially with service clubs, Lions, Elks, Optimus, kind of you name it, is the depth and breadth of the programming that they are delivering in communities day in and day out that you may not really realize is happening. So yeah, I think our listeners would love to hear more about what programs the Sight and Hearing Foundation is doing.
Okay, we'll start with the oldest, because you did talk about anniversary and length of service and age of our Lions. So the oldest program we have is patient care, first and oldest. And essentially that is a program that anyone can apply for. There are eligibility requirements, of course, but it basically what this does is provide access to surgery. So surgery and treatment. So if you have a significant hearing or sight problem and you're underinsured, uninsured, or you can't afford all the extensive costs that go with surgeries, whether that's cataract, anything to do with retina, corneal transplant, corneal cross-linking, serum treatments, anything at all, that is how you get help. And so Lions are what I love about them is, they have such a long history. They know their communities really well. They've been there for generations. So they're going to know a doctor, they're going to know a banker, they're going to just know people in the community. And they also know their neighbors. So let's say there's a neighbor that's struggling. There's a family, whatever. And so they're going to say, hey, our club can sponsor you. Here's how you apply for funding. And we have, of course, online forms. Everybody goes through our main portal in Portland to apply online, and Lions clubs are essentially assisting us with that application. They're sponsoring a fee. We're putting in our part of the money, the pot of money. So that's the first program. It's getting you the more serious treatment you need. The second program that connects with this is our Lions Eyeglass Assistance Program, LEAP. So this is more so obviously vision. Again, very, very similar model. People need eyeglasses. This is for adults, this program. Eyeglasses are out of reach. Cost of lenses, cost of frames, that's not all covered by insurance, if at all, right? How do you get that? How do you find high quality, low cost glasses?
Right.
You work with us. We have a charitable edging lab in Portland. We edge glasses, over 2,500 a year. We work with optometrists, ophthalmologists all over the state to provide those subsidized and lower cost fees for service. So that's a whole nother thing. We dispense the glasses. We work, we'll send you the glasses, or we'll work with a local optician to dispense. But we do make those in Portland.
Wow.
And then I just want to say also the other piece that I always want to mention as so crucial and equally accessible is our Roar Hearing Assistance Program. Because when we talk about surgeries and eyeglasses, yes, that's out of reach. But what about hearing aids?
Right.
How much do they cost? Do you know?
Well, I think it depends on the type of hearing aid that you want. Right. I mean, I've seen hearing aids run upwards of $5,000 to $7,000 a pair. Not covered by insurance.
There you go. there's the problem, right?
Right.
How many
Right.
people are going without? And typically we're seeing older
Hmm.
folks. Not always, we have a range, but our majority, I would say 55 and older. And so this is a huge area where folks are isolated.
Hmm.
We just received a grant from the Cambia Health Foundation for an aging to reduce isolation
Hmm.
among elders. And so hearing aids are the big piece to that.
Right. Right. Because now you can participate in the conversation. You can hear what's going on, on the news if you want to watch the news. I mean, maybe you don't right now, or being able to talk on the phone with friends, loved ones. Yeah, I would imagine that again, two very core senses, vision and hearing, lacking either can be very socially isolating, especially for older people, right? So
Exactly.
yeah, so I would imagine that one of the challenges that the Sight and Hearing Foundation faces would be demand. But this is the next question. I'm really curious to get into what is the biggest challenge that you have? Is it demand? Is it membership in Lionism or service clubs, or is it a combination of the two or something else entirely?
Combination of the two, for sure. And then there's an interesting problem solution in what you just said, because one of our other programs, the School Vision Screening Program, which we don't have to go into details now, but I'm bringing up now because that program screens 200,000 kids, excuse me, for vision screening. We're not identifying problems, we're just identifying possible problems. And Lions are phenomenally involved in this. They volunteer, they go to the schools. I mean, we're talking like 600, 700 events a year. So many kids, hundreds, we just passed our 2 millionth kid. Lions are showing up at schools. They're volunteering to screen. They're doing outreach. They're doing follow-up. There's plenty for them to do. Like you said, there's plenty of demand, so Lions can be responsive to this. However, on the flip side, Lions are getting older. Every week I have a Lion tell me, Nicole, I'm tired. I'm slowing down. And then, they're in their 80s and I'm thinking, wow, if they're slowing down, what am I? And they struggle because they want to do so much more. There's need, but they're like, there's not enough folks in our club. We're not getting enough young folks. There's only one younger person in the club and they're being asked to do everything.
Right.
So how are we going to address this?
Right. And where does the Sight and Hearing Foundation, so, because of the partnership that you have with Lions Clubs, and they're really, they're doing the work on the ground because, like you said, you can't be everywhere in every community. Where or how can the Sight and Hearing Foundation further, what's the right word? Further support the partnership that you have with Lions Clubs to ensure that they have the resources or the membership necessary to be able to do what they want to do in their communities? Is that even possible?
So that's a great segue into sort of how we've had to pivot and what we're trying to do for Lions. Sometimes they tell us we don't have enough to donate this year, our donation's lower. So it gets into the whole issue of you're talking about. There's less folks to do the volunteer work and fundraising. So what we want to do, and what we've been doing for several years, I'd say since the pandemic, is accelerating our training. So Lions and tech, I think this is a fun topic because I've learned that they're confident with tech as much as I am, even more sometimes. So we're trying to help them with tech tools and ideas so they can increase membership, like, improve their websites or build their websites, figure out how to use more apps, figure out how to do social media, how to, engage people online, how to do fundraisers online, in the hope that they can get younger people donating, volunteering, get parents involved, parents with kids, just like bring in multi-generations.
Right.
So a lot of Lions are doing things like that. They're
Mhm.
working with us. They're asking us, can you help us? I do a lot of press releases to get media for them so that people are at their events, so that people can say, hi, I'm a Lion, here's what I do. So a lot of trainings, I would say, are probably the first step.
Right.
And presentations, whether that's in person or through virtual like we're doing.
Great. So with all of this work that is being done and all of these incredibly crucial programs running, kind of headlong into the demand and, the challenges that you're facing, what is success looking like for the Sight and Hearing Foundation? What does that look like?
Success resembles, I mean, in an ideal world, right? We'd love to get
Sure.
people's health insurance sorted out. But let's not talk ideal worlds, right? Success looks like improved and more broad access to our services. One of the problems you can imagine are, as I mentioned before, geographic, but as an Oregonian yourself, these challenges. There's parts of the state that are rural and tough to reach, right? So how do we bring more services to them? How can we get more eyeglasses edged and sent out to people who are really far away from opticians or a population center? How do we edge more? Maybe we have another lab in Southern Oregon or Central Oregon. Success would be that. Getting more hubs.
Sure, to provide more access. More access. That's really great. So how do you pay for all this? Let's talk funding, right? So, you oversee development and marketing. I've worked in fundraising for a long time. So these services are, for the most part, offered free of charge or for a very low or reduced fee. What does fundraising look like? What is it? Where are these resources coming from?
So traditionally, funding was almost all from Lions clubs, 90%, right? So back in the day, the 50s, the 60s, up until the 80s, I'd say. And Paul, you know this well too. Lions clubs did all the fundraising. Their clubs were hundreds of members, 100-ish, 50-ish, all fundraising. They were younger. They were probably putting in some of their business profits. So the foundation didn't really have to worry about fundraising. So there was, and there was a smaller scope of programming. We've expanded programming since then, especially to include more around hearing and mobile services. So then, membership declines, donations decline, clubs fold. Things start getting tricky in the 90s. So you start looking at grants, contracts, corporate sponsorships, and you just, you keep going. And since I joined the Lions in 2011, we have watched that percentage flip. So now our Lions Club funding percentage of the budget is like 6%-ish. I might be misspeaking, 6 or 7, maybe 5. So there's a lot to fundraise from the rest of the budget pie. Which look like grants, sponsorships, government contracts, which are now iffy, individual donations, recurring donations, and then my personal favorite lately are donor advised funds.
And yeah, let's get into that a little bit. Before we started the show, we were chatting about intergenerational fundraising and intergenerational philanthropy. And this must be, you must be seeing that in particular quite a bit. The idea of, generations of families participating in Lionism, participating in their community. And so how do you navigate that? Right. So it could be that, mom or dad were really super involved in their club, but now they've started to slow down. Maybe they have, they're not participating anymore. How do you engage their families, right? How do you engage their children, their grandchildren, potentially, to continue securing the support necessary to fulfill something that, they were so devoted to?
I'll give you a good example of a particular family in the Portland area. So the parents, who are now 80s, 70s, let's just say like what that top generation, right? What you just described. They've been Lions forever, active on our board, or prior active on our board, active on our committees. We have a patient services committee, etc. You get the meaning here. Super active parents. They cannot be too active anymore due to health, age, with some exceptions, right? Their kids. Okay, so as you said, there's a lot of families where that is pushed down generationally and valued, extolled, if you will. This particular family, one of their children was currently Lions Club president, so they took over the leadership reins of the club. Very active in local projects, in partnership with us, events, fundraising events, such as, we have a Shamrock Run. You could do all this online. You could fundraise online. There's all kinds of events we do where kids and grandkids could help mom and dad, grandpa, grandma with the fundraising piece online. And again, in this family, the second generation after the kids, the next level, one of the grandchildren, I believe, or a spouse who married into the family, they are one of our seasonal vision screeners, part-time employed by us. So there's a nice kind of thread you can kind of pull, if you will, in some of these families where maybe it doesn't look exactly the same as it did in the 50s or the 60s. Right. But their kids and grandkids are helping grandma and grandpa set up a Facebook fundraiser for the foundation. I mean, truly, that brings in $500 for no cost. They're just doing it because they love the mission, and their kids are helping them. So those sort of, I guess, tech tools, we're trying to train and share and get them involved in that way too for our events.
Yeah, no, that's fantastic. I do want to come back though to what you said about donor advised funds. And, donor advised funds, it's like all in the conventional media, it's all over the philanthropy press. The donor advised funds is kind of the recent hot thing. I mean, and whatever you think of donor advised funds, it is a tool or a vehicle to give that is here to stay. So how is it that you're, and I would imagine that, and maybe these are two slightly separate topics, but also legacy giving. I would love to hear a little bit more about how you are promoting donor advised funds, giving through a donor advised fund, and legacy giving, because this seems like the perfect constituency for both of those vehicles for making a gift.
Paul, you know what I love about you and talking with you is you have the big picture, you have the tie-ins, you have the, I just love that I get to talk development with you, because it's nerdy, it's fun, it's human nature. So I love your question, and I think the best way to answer that is when I started working at the foundation, like one day I remember this packet of legal documents arrived, and it was, smartphones were newish, right? Of 2011, we were online, of course, but not the way we are now. And I remember thinking, okay, what are all these legal documents? And of course it was a bequest, and it was a person that we had never engaged with. They were never an Oregonian. They weren't even a Lion. They were a nurse in the Midwest, I think Michigan. And unfortunately, other than speaking to their lawyer, I didn't have any direct contact with their next of kin or anyone that could tell me why. So the lawyer and I made some assumptions about, they were in healthcare. They did some vetting and looking around and decided that Oregon Lions, the connection to Helen Keller, that was something, that maybe this person cared about. I bring this up to say, I hadn't really thought about it much before. And I was in development and legal services for many years prior to the Lions. And it never really even occurred to me to think about legacy planning, bequests, and wills, and estate planning, and all the stuff that I'm just now really excited and working on diligently and learning as I can. We get a nice amount of packets in the mail, and I speak to a lot of lawyers on behalf of their clients and what they want to do and what they've left the foundation. So we engage with this tool, freewill.com, and it's an online platform, and it's game changing for us. You can create your will for free there. You can create all kinds of medical directives, power of attorneys. It connects to the whole larger issue of estate planning and deaths. And we've been receiving some identified gifts there, or we're promoting it. We're asking Lions to go and, share this free tool with anyone. So to answer your question, I spend a lot of the week, every week, talking to Lions about their future plans or redoing their will. A lot of them did their will ages ago, and now they want to make some changes and leave a gift to the foundation, or the next generation, their kids are doing their wills. Right. So that is a real pivot for me in the last 10 years. Yeah.
Sure. But what you've said here, I think, is so interesting, is there are lots of, as philanthropy has evolved, there are a lot more tools to make things like creating a will, setting up a DAF, even other exotic instruments, makes it so much easier. But what it sounds like to me is that really at the core of this, it's about communicating with your donors in a way that invites them to think about what they want to accomplish long term, and how supporting the foundation through a vehicle like their will or estate plans or a DAF actually makes that possible. So really, at the end of the day, it's all about communicating a need and giving people, this is what I'm hearing, it's communicating a need and inviting people to see themselves as part of the solution.
You define that really well, and I can give you an actual example of how that works, how that plays out.
Yes, that would be great.
So there's a couple, they passed. They were from the Eugene area, and they were deeply committed to Lionism and Lions work in their community, and had already put the foundation in their will, right, to continue the legacy of their work, right? However, just before they passed, we got to know them, of course, prior to this will change, but they wanted to change their will, and mostly because they started getting involved with school vision screening and hearing about it at Lions Club's meeting. Because, it's all talking, right? It's all about the club meetings in person, the coffee, the early breakfast. And they heard about these spot devices, which are these digital tech tools, is how we screen kids' vision in like 2 seconds, right? And so our CEO was showing this lovely older couple the devices. And sometime later, this was like 2015, I guess, when all this sort of evolved, and after they passed, they had changed their will because they were so excited about this slice of vision care and how this technical new device could screen so many more kids at this, really not a very high price, right? And screenings cost in the doctor's office, I think they're $75 or $80, probably more now. So we were doing this for free, right? For every kid, free. So they actually left an even more significant gift in their will. to vision programs, the specific programs we're talking about. I mean, so I guess I'm trying to hopefully articulate this well, is what you just said is exactly the result in perpetuity, right? We're getting a bequest. We can put it in our long-term investments. We can pull from it according to our bylaws and our policies. And this goes to vision programs. This sustains and helps so many kids and adults.
Right. Just because you were able to show someone a really cost-effective, efficient way to do something, like really do something in their community, right? It was a very easy invitation to participate and really move from need to benefit through a very plausible plan. So yeah, that's fantastic.
Exactly.
Okay, so if you're prognosticating, where's the Sight and Hearing Foundation? You know, where do you want it to be in 5 years? What do you want to be doing in 5 years?
Well, I know program staff would want me to really, really impress upon your audience that vision and hearing are a right, not a privilege, that we shouldn't be prioritizing care. We shouldn't have to jump through hoops. It shouldn't be a question of what you have financially or where you are in the state, etc. So from that perspective, in 5 years, you know, we'd love to have, again, sort of those hubs, sort of have more, maybe some small edging labs in each district. So there's 1, 2, 3, 4 districts, you know, have more access so that we can edge more glasses. In southern, central, coastal areas, there's massive need on the coast. There's just a lot of poverty, as you know. There's a lot of like gaps in service. So let's get an edging lab out there. Also, same for hearing aids. Let's get more mobile RV or medical vans. We currently have one right now. We have a mobile ROAR screening hearing aid program. We work with KCI Institute at the Oregon Health Science University, and they have a mobile van for eyeglasses, for exams, full refractive exams. So let's get a fleet of vans, like high-tech vans.
Right.
Let's get them out and moving, or in hubs. And essentially ensuring that no one is missing care. You know, 5 years, I'd like to see more of that regional presence.
Right, because that just means more access. It means a shorter distance, you know, kind of more in your, maybe not community particularly, but closer. Right.
Exactly. We pay for a lot of travel. So yes.
Yeah.
Exactly.
Yeah. Okay, so you know, as we're winding this down, Nick, this has been so fantastic. Obviously, you know, the Lions Clubs of Oregon and Lions Clubs across the globe are doing really incredibly important work. I really like what you had to say about how sight and hearing are a right, not a privilege. And you're really, you know, I think that it sounds like for a century, the Lions, wherever they may be, have been fulfilling that promise of ensuring that vision and also hearing are a right. And it's not something that only certain people are able to enjoy. So how can the public support the Sight and Hearing Foundation?
We have many ways. You know, support has different forms. It has dollar signs. It has in-kind, non-dollar signs. We have events. We have plenty of events. So our webpage, of course, is the best place to go, in our socials and all that. So olshf.org. We have all our event overviews there. We have a golf tournament. We have the Shamrock Run in March. We have a brunch gala event that's new in April. There's tons of activities. You can volunteer. if you don't really have the means to donate financially every month or at an event once a year, you could go to a school vision screening. You could help take the spot device, click, click, help kids. You can volunteer in our office. We have sorting parties. You can help us recycle eyeglasses and hearing aids at our warehouse. We have really fun sorting parties with Tracy Brown, who is our warehouse manager. And also she works in the lab. She's our LERC manager. She's a bundle of energy. You know, that's a really fun volunteer project we have with groups. We get some sororities out there. We get other service groups. We get Central City Concern, folks in that program. There's even some volunteer work in our office for those folks that like office work. And of course, I want to say Lions in general. You want to go to a Lions meeting? You want to learn about Lions? You can go to any one of their meetings, you know, and they'd love to recruit you. And they do fun stuff. It's not all service. And I mean, the point, of course, is service to your community and your fellow neighbor and your, you know, your community at large. But there's also, you know, all fun social events that they host.
Yeah. Yeah. Well, this is great. Again, thank you so much. I think you mentioned the website. I'm assuming that that's where someone can go if they want to, if they're feeling really inspired about participating with Lions, they can come to the Sight and Hearing Foundation's website. Do you want to mention that one more time?
Thanks. Yes. olshf.org.
Great.
.org, and you'll see all our socials, our YouTube, LinkedIn. You can find me there if you want to ask me questions. Free will. You can have access to a free program to start your own will. I'm working on mine. We should all start thinking about it, regardless of what charity or any you want to contribute to for your legacy. It's still a free platform to learn how to make your own will. So I really want to like put that out there to your audience as something, as a takeaway they can have.
Well, fantastic. Thanks again so much for being here today. We really enjoyed it, and we'll talk soon.
Thank you, Paul. Great to chat.
Fantastic.
Bye.